your DERMAPEN procedure, to add a more holistic, to add a more relaxing approach for this. But then also for faster clinics, there's ways that you can accelerate so that you have a fast, efficient, focused pinpoint precision for every patient every time. I apply the sleeve. Don't just stop halfway, roll that over the entire length of the device. You will be able to see the screen. Last night we landed quite late, but I have been to Hyderabad before, and the first thing I remember is how long it took to get from the airport to the hotel. So for our patient, I want to associate the sound of power with the sound of efficient regenerative synergies, maximization for number of puncture channels, which could be anywhere up to 1 million in one treatment, and now to maximize results and our solution. So I want you to imagine that you need to get to Hyderabad Airport as quick as possible. In this case, speed 1 is like walking. It's possible, but not the most efficient. Speed 2 is like riding a bicycle. Speed 3 is taking a car. But we all know the quickest, fastest way. I'm going to do this tomorrow night to get to the airport, to avoid the traffic, is helicopter. Private helicopter, private jet. You can imagine if you're on an aeroplane and if you couldn't hear the motor, that's scary. So with this, we associate motor with power. Power equals drive, power equals 2,000 puncture channels per second, which now activates mechanical, electrical, and chemical regenerative, but also non-donor dependent chemical regeneration. So, in my mind, I have some figures, but remember what you see is more important than the number up here. So, we apply some solution onto the forehead. We are sitting above the nerve receptors, so the patient, Merkel cells will acknowledge a vibration, a sensation, but not sharpness. That's not anatomically possible. Working quickly, vertical. An area that I'm conscious of is avoiding cosmetic tattooing, just so that you don't spread or move pigment. All done. Vertical. Horizontal, a single strike. Diagonal 1, diagonal 2. Complete. Look at the color that we see. Do you need to sneeze? No problem. Particularly around the upper nose area, around the eyes, some patients will sneeze, or from the vibration, they will burst out laughing. But we can see a nice haze of red. I can feel a nice haze of heat. I get you just to tighten your bottom lip. So we take into account that there's increased skin density at this point. So increase your needle depth, now working down. Vertical. This is more comfortable. So the reason why I work the forehead first is because it tends to be an area of increased sensitivity. So vertical, apply more product. Horizontal, diagonal 1, diagonal 2. So there are some tiny little pinpoint blood response around the perioral area. This is great because it means that my needles are intervening with melanophages. So we identified as part of our consultation that it was this area which had some mixed and dermal pigment. Increased needles, vertical, working quickly, horizontal, diagonal 1, and diagonal 2. All done. Look at that red undertone come through. So we know that we are exactly in the right position. Apply more product. The other side, vertical. So having a fast, rhythmical movement, we're over 50%, diagonal 1, diagonal 2, all done. So now we have all the tough areas out of the way. Everything else is comfortable. Would you believe that around the eyes, because of the placement of nerve receptors, is extremely comfortable, never any pain? So around the eye area, what you'll feel is intense vibration. So either this can make the patient want to sneeze, they will laugh because it tickles, or it will start moving with the vibration. So I come in peripherally from this area here, back in. So it's a very weird sensation, but not a pain. Now the other eye. So the patient closes their eyes because of the vibration, not because of pain. Distribute product onto the forehead. If you feel any product in your eye, just let me know and I can give you some gauze. And I get you just to tighten your upper lip over your teeth for me. Thank you so much. Increase needle depth onto the nose, vertical. Now the upper lip is also a little bit sensitive, so which is the reason why I do this last. Now, working quickly. You are all done. Fast, methodical. I choose, don't do this over the patient's face, but next to the patient, with your dominant hand, remove the sleeve, and then directly into a sharp spin, a single-use needle cartridge so that they see confidently nothing is reused. At this point, soft dry gauze soaked into disinfectant solution. We need to work quick to remove any blood which has a pH of 7.48 and to also remove any mesotherapy solution which has a pH ranging up to 6. The Uber Pro anabolic chemical peel has a pH of 2.05. So to ensure that it doesn't neutralize and to ensure that it absorbs effectively and flawlessly, we need to make sure that we remove residue, but also make sure that the skin is dry. So just dry, soft gauze. The skin has a nice pink-red undertone to it, but this will soon dissipate. So your patient should feel and experience like a mild to a moderate sunburn anywhere up to about 36 hours. But look already with 35 milligrams per milliliter of triple molecular weighted hyaluronic acid, the glow factor. So as I wipe away the skin, you can still see that it is plumped, that it is volumized, it's comfortable and hydrated. I choose to use a sterile consumable. I also choose to take the peel over to the patient so that you don't risk product going into their eyes. So you'll feel a slight sting followed by a warmth. 7, 6, 5, 4, 3, 2, 1. Perfect. So this will begin to further reduce. It smells, so you can smell mandelic acid, but this can be safely applied. There'll be a slight sharpness just on the upper cheek, on all Fitzpatrick skin types and ethnicities, and you can apply it just underneath the eyebrow, and this will help around the periorbital area with pigmentation. Yep, so you're going to feel what you have is a change of pH. So the skin color has not changed. So the skin color is not red. So what this is your skin pH changing. There's no burn. So what you feel is like little ants crawling all over your face. So the little ants is a change of pH. It's not the skin undergoing attack. So what I'm looking for is where we had some small pinpoint blood just underneath the bottom lip. This is not increasing.
You can increase the AC if you want.
What we also see is a nice uniform approach.
She's feeling burning.
Which means that the chemical peel has absorbed perfectly. This is the perfect time. So now we move into post-op. So I'm going to apply the Hyla Active 3D Sculptured Mask, Bright Light. The center seam down the center of the face. Would you believe that there is one entire 30 ml bottle of DP Dermaceuticals in this product? It contains 10 milligrams per milliliter of triple molecular weighted hyaluronic acid, plus zinc, sodium, manganese, magnesium, iron, and copper ferments, plus copper peptides and provitamin B5. As we apply this into position, it's instant cooling, instant comfort, and an instant change of psyche. So the patient's last thoughts is not needles, it's not chemical peel, it's a process of comfort, of soothing. So you can use the vibrational tip on the end of your needle cartridge to now promote lymphatic drainage. Just pressure point, just create some comfort. But what I'm also looking for, and the reason why I'm moving the mask around and pushing it into the skin, is to make sure that the puncture channels are closing. So there's no blood coming out, the patient's not an infection risk, you don't need topical or oral antibiotics. I can feel the heat leaving the skin, there's still a little bit of heat in the lower part of the face, but this is tolerable. So with this process, depending on the style of clinic that you have, depending on the appointment time, the cost that you charge, I would recommend that you leave this on for at least a 7-minute time period. We know that that is clinically when the puncture channels are fully closed. But we can also see that the puncture channels are not an infection risk. There's no blood coming out. Likewise also with this process, you could leave this on up to 15 minutes, 20 minutes. If you are using LED or red light, near infrared light, this mask is not compatible. So because it's a physical cellulose fiber, it will block the light. So we do produce a hydrogel mask which will facilitate the light. It's completely transparent. And you could use that as a treatment upgrade. You could use that as a complementary way. The advantage for light therapy is the activation of adenosine triphosphate or intercellular energy. But otherwise, you can see that this is a comfortable, relaxing process. It allows for you to reconnect with the patient, but this is the perfect procedure. Perfect response, perfect visual endpoint, perfect reaction, and also as I watch the patient's hands and watch the patient's feet in my peripheral vision, it also was the perfect reaction for the forehead, a little bit sensitive as I promised, but I also end with the upper lip, which is a little bit scratchy. But otherwise, we've got a tolerable procedure, an efficient procedure, a profitable procedure, but we maximize the regenerative cascade because there's no topical local anesthetic, creating vasoconstriction, and also affecting our regenerative healing response. This was your first Dermapen 4 procedure and your first regenerative medicine synergistic procedure. How did you go?
I'm fine. It's just
Yeah, you have some product around your eye? I'm going to put into your hand some gauze. And if you'd like me to soak that into some disinfectant. You're comfortable?
Yes.
I'll just do a quick sweep. Just close your eyes for me. So this is where saline or some disinfectant solution just processed into your treatment setup is always advantageous. If the patient licks their lips and ends up with chemical peel on their tongue, any of these strange scenarios, if a patient scratches their face, any of these scenarios. Let's imagine that for timing, this has been on for 15 minutes. We saw how the skin was prior. Look how the skin is even after this shorter time period. It's plump. The skin has a fresh, regenerated appearance. There's no frosting, there's no blanching. You can't scab from the Uber Pro combination therapy.
Is it normal for the burning sensation to last?
So remember that you've just had 2,000 holes per second delivered into the skin. So depending on how long your treatment procedure is, that can be up to 1 million puncture channels per second. You're going to feel a mild to a moderate sunburn in appearance and sensation, and that can continue up to 2 days for this. Likewise also, in addition to 2,000 puncture channels per second, what we've also delivered into the skin is the regenerative MG collection. With the regenerative MG collection, I've got some remaining product. I'm going to press this into the skin. Always acknowledge, but always determine, I can feel warmth in the skin, the difference between a burn versus change of pH. So, patients will feel like little ants running all over their skin. Patients will feel, in some cases, rare cases, an intensity of warmth moving into some heat, localization particularly around the upper cheeks. There's no redness on the skin, there's no frosting, there's no blanching, so we know confidently that this is a change of pH, this is not burn, this is not reaction. I move into post-op, and these will be the same products that I'm going to give you. I begin with the vitamin-rich repair. These are available in 250 ml aseptic airless pumps, so this is a lot more economical for the clinic. They're also available for the patient in a 3, 15, 30, and 50 ml size. This will re-epithelialize, promote comfort, hydration, soothing, and a flexibility to the skin. This is not to be substituted. If you use the wrong product, it will trap heat in and won't allow the skin to breathe and can slow down your regenerative cascade. The final product I apply over the top is called Cover Recover, which I describe as being a bandage in a bottle. It's a broad spectrum SPF 30, a base of 3 types of re-epithelializing silicons. These cannot absorb into the skin. These form a breathable protective layer. It contains zinc oxide, titanium dioxide as a physical sun protectant, but iron oxide as a colorant, which disguises any redness, facilitates perfection, and it also contains a thermoregulator to take heat, a probiotic to rebalance the skin's biome, and the iron oxide, as you can see, blends flawlessly. It's available in multiple colors so that you can ensure a natural and undetectable finish. But with a broad spectrum SPF 30, the patient can reapply this in 3 hours' time. So you can perform your Dermapen 4 regenerative medicine synergistic solutions in summer, on a humid day, on a hot day, in winter, in spring, in fall, any time of the day, any time of the year, and it leaves the epidermis intact. It does not make your skin any more photosensitive than what it was beforehand, but post-op application of our Cover Recover creates coolness and comfort. You can see a flawless finish to the skin, but also the patient can reapply. You can go to bed in this tonight. You don't need to wash your face tonight, so I describe this as being a bandage in a bottle. Do you feel the cool sensation? Perfect. So it's a lot more comfortable. You can also use this product following any thermolytic procedure, chemical peels, injectables, and that's a flawless natural coverage. So this is our regenerative synergy as part of DermapenWorld. Mechanical, electrical, autologous chemical, plus 2 approaches of non-donor dependent chemical regenerative synergies, all joined in as the ultimate procedure.